Hi, this is Michelle Strauss-Salinas, the Director of the SoUth Indy Quality of Life Plan. For SoIndy's Fall 2020 Summit, we created a video to share with community on the progress of the SoUth Indy Quality of Life Plan. This video can be found on our website at www.soindy.org on the media page. As part of getting community feedback, we created a survey and asked residents for feedback. What we heard was that we need to continue our focus on providing COVID-19 resources and opportunities first and foremost as we move into 2021. Several SoIndy leaders and residents have joined me in this video for a question and answer session to help us reflect and plan our response to this pandemic. Christy Todd, co-chair of the SoIndy Health and Wellness team, joins us first with a recap of what her action team has been up to.
I know this year we have distributed food. We have communicated about food pantries that are available in our areas. And then I know also more towards the beginning, we did help out with, well, Michelle helped out with distributing PPE material to local businesses. And that's all I have.
So does anybody with maybe that works with one of our partner organizations, not necessarily an action team, want to talk about how COVID has affected your kind of partnership with SoIndy or initiatives?
I can talk a little bit about how we've adjusted and worked together. I'm Jim Walker. I'm Executive Director of Big Car, and we are in the Tube Factory in the Garfield Park and Bean Creek neighborhoods both. Part of what we've been working on is just trying to figure out how to continue to support things like this where you have to work online versus usually one of our biggest things was allowing and just opening up the space for people to meet in person. So trying to figure out how that could happen and working with Michelle just on the technology side. And then another piece has been that we're utilizing the radio station a lot, which is WQRT, to share information and share opportunities with listeners. We know we have quite a few from the neighborhood, and that's been an area where we can work without needing to be concerned about social distancing.
Great, thanks.
Michelle, I can just say a few quick words from the university's perspective. This is, for those I've not met, I'm Andy Coker. I work at the University of Indianapolis, and I think obviously COVID-19 has had a serious disruption in how we traditionally do business, but we were very fortunate to make it through the semester, had good protocols in place that allowed us to complete the semester as safely as possible. One way that we worked closely with SoIndy and particularly the University Heights neighborhood is that we were very intentional in talking to our students and making sure they understood that, some of the traditional social activities that may have been happening in the neighborhoods would not be tolerated this year. And I'm proud to report that we did not have any known reports that I've heard of large parties or disruptions of our students in the neighborhoods, potentially putting residents at risk. And so our students did a great job, really, really great job of being conscious of our neighbors and of our community at this time when they were, impositioned in many other ways. So I was real happy with that partnership. And we continue to, some of our capital projects along Shelby were slightly delayed, but we're continuing to work on 2 buildings that we should have open very soon. One will be our facilities building, and then one will be our R.B. Annis School of Engineering building. So you should see both of those projects completed within the next month or so. And then we'll start working on some of the additional work that we need to do around those areas. But so far, so good from the University of Indianapolis perspective.
I would just maybe add to that with your construction of the buildings on Shelby Street. We had a partnership with KID and INHP to put trees along Shelby Street, and the university agreed to take on, I think, 10 trees. But unfortunately, because of COVID, we weren't able to do those plantings this fall, but have every hopeful intention to be able to do that in the spring. So yeah, that'll be nice. So just kind of like looking back as to how we've been affected, but kind of looking forward for the next 6 months, what role do you think that your action team or your organization can continue to play or begin to address related to the COVID-19 pandemic? Anybody want to tackle that? Oh, yeah, Michelle, you can unmute.
Yeah, so being that there's so much for us to tackle, I know that it's just a matter of us putting in place our pieces. So I know right now we have Dress for Success partnership with them that we need to go ahead and just be able to take steps in the direction that we need to. So, you know, I am looking forward to the next 6 months or so because, you know, obviously, you know, we need to get beyond, hopefully we'll be beyond the whole COVID situation, but really being able to implement ourselves in the best way.
Hey, Michelle Traub Campbell, I can add from a healthcare perspective where things are going. And if you haven't just heard the news, it looked like the Pfizer vaccination was approved today by the FDA, just here, I think this evening, which is a big step. We anticipate as a hospital that we will start getting shipment. We'll get 11,000 doses probably Monday or Tuesday. And we will then start vaccinations of our employees, probably 500 to 700 a day. How this vaccination works, it's a little different. It's called a messenger RNA vaccination, which is different from live virus in the past. It's actually been studied for decades. Science has come along and advanced here very quickly. And it's a 2-dose process. First dose, at least Pfizer's vaccination is a 2-dose. Moderna that will come next is a 2-dose vaccination. And then down the road, probably March timeframe, Johnson & Johnson will come out with a 1-dose vaccination. Rates of success, about 90 to 94% between the Pfizer and Moderna vaccines. From what I have been told, the second dosage will need to be done between 21 and 28 days after the first. And then after that second dose, within 7 days, you should be, your body's immunity system should be fully engaged, and hopefully you'll be virus free moving forward. It's going to be a heck of an effort here to get the vaccinations out and done. Our plans are we will be vaccinating nursing home employees around the South Side as well. That will be our responsibility. And CVS and Walgreens will be vaccinating the patients in nursing homes. So I'm going to try to hit the most vulnerable first. And then the state will continue to roll out the plans. I'm sure first responders will be in there shortly after. I've heard some about teachers will be in that next arena that gets vaccinated. So really, really good news. I mean, this is a really phenomenal accomplishment by science to get this done in the last 9 months. I mean, it's an amazing accomplishment for our country. Herd immunity. You've probably heard a little bit about that. We figure that we'll probably be at herd immunity sometime around the May-June timeframe. So that's when you'll start seeing, I think, a lot of changes with not having to mask up and be so sensitive with the social distancing and those types of things. But I'm sure you'll hear more about that as time passes. So we're excited, we're optimistic. Our hospitals are full. We have about, I'll give you an example at Community South. We have 167 beds. We have added beds. We are continuing to do surgeries as well as taking care of our COVID patients. About 1/3 of our beds are filled with COVID patients at this point in time. So the governor just yesterday had an executive order come out. So all elective surgeries will stop as of December 16th through January 3rd at all hospitals. And we want to make sure that that's not a mixed message. We want people that need treatment to come in and get treatment. It is a safe environment to be in. We have done, we've been very, very diligent about how we've set up the hospital, the floors, coming into the building, all of those things. We learned some very valuable lessons from back in the March, April timeframe, and much better prepared. Mortality rates are better. You're hearing about more mortalities because we've had more positives. But when you look at where we're at versus where we were at in March, April timeframe, we are not ventilating all those patients. We are now using a lot of what we call high flow oxygen, which is a lot less invasive. And then we're using what we call mask ventilators in a lot of cases. So treatment regimens, all of those things we've been able to make some huge headway on. So there is some really positive news in all of this. Because I know there's been a lot of doom and gloom about it, but there is a lot of positive things that are happening. And I think this is step one and moving in the right direction. So any questions? I hope that covers things for people. And if you have questions or I wasn't clear on something, please don't hesitate to ask.
I don't think you introduced yourself.
Oh, I guess I probably should. I just started
Yeah.
talking, huh? Yeah. Hey, I'm Rob Campbell. I grew up in the Garfield Park area. I currently work for Community Health Network. I'm a respiratory therapist by trade and went back and got a little confused and got a marketing degree and finishing my MBA now. So I ran the respiratory care departments in our hospital. Now I do business development, work directly for Dr. Dave Kiley, who is the president of the Indianapolis region. And obviously, Andy, very involved in SoIndy. I think he is a board of trustees member, if I'm not mistaken. So
Yes. Yep.
We appreciate our relationship. Yeah, we appreciate our relationship with SoIndy, appreciate our relationship with SoIndy, and I grew up in Garfield Park. So it's close to my heart. My mom and dad actually live there still after 60 years on Manker Street. And really, always appreciated that area. Is that okay now, Michelle? Sorry about that. I just started talking because I'm so excited about the vaccination because it is such a big deal. And, our clinicians have done a wonderful job. It's been a long 9-month period because this has not stopped. It was a big peak in March, April, May, and then we started to see it right at the beginning of November. But we've been dealing with this obviously now for 9 months. So we've got a lot of great team members and people have just done a wonderful job.
Well, you definitely get the Beacon of Hope Award for tonight. So thank you for your positive messaging. Always appreciate your insight with your position at Community Hospital South. So thank you so much.
Mm-hmm.
So again, we had another question that's just kind of going right to the heart of like, what do people need right now? Like, yeah, the quality of life plan is important, but what our people are hurting and what can we be doing right now to help people? And so the next question on my list is, how will we respond this winter to community needs? So, this pertains, I think, to some committees more than others, but I would just challenge you to think, within your committee, what could you prioritize? So maybe some of you have already thought about that. I know, Michelle, you kind of reflected a little bit on that already. education and workforce development. But does anybody else have anything that they would want to share? Just kind of focus on the winter. Yeah. So Cheryl, you're over at the library. Is the library got any plans in place for the winter needs?
No, not really, because we're so kind of restricted by doing a lot of that stuff. I mean, in the past, we've collected gloves and hats and things like that, but because of the COVID-19, we are not doing that because we don't know if any of those diseases are on those gloves and hats, so we can't even do that. And now, because people can only be in the library for an hour, we used to let the homeless come in and sleep for a couple hours. We can't even do that because we had to remove a lot of the chairs that were there. So now they can come in and sleep, but it's only for an hour at a time, an hour per day. So we probably need to put our heads together, because I feel like in the past we did a lot for the homeless in the winter, and I feel like we really have nothing in place this year. And this year could be a really awful winter. So unfortunately, I'd have to say we're not prepared to do anything at this point.
Yeah, Cheryl and I were kind of the neighborhood SoIndy people that started facilitating the SoIndy homeless advocacy group. And so we haven't really been meeting because of COVID. But based on what you just said, I feel like maybe that's something that we should go to the top of our list, is reconvene our group, and which includes some of the local churches that are serving, and our outreach teams, and just make sure everybody's coordinated. You know, I'm not asking that we necessarily do more. I just say, can we do better with what we have?
I agree with that.
All right. So the next question I have is, are there adequate food, or is there adequate food access in SoIndy? And I was hoping our friends at Southeast Community Services would be on this call. I don't mean to pick on you, Cheryl, but yeah, go ahead, Jim.
I would say one thing that is continues to be a challenge isn't the availability of food options for purchasing food. It's the safe way to access those for people in the different neighborhoods. So, for instance, Aldi is close to a lot of us, but to safely get to Aldi without a car is not very easy. So I feel like there are still some things that need to be addressed with how East Street works, how Madison works, how you can get from, for instance, my house, which is north of Garfield Park, to Aldi on a bike if I had a little kid with me, or somebody in a bike stroller, whatever, behind my bike to go to the grocery store. Even if I wanted to go over to Safeway from my house, which I do walk over there, now that my son is 18, I trust that he can do that. But when he was 13, I wouldn't say, okay, you can walk a couple blocks from our house over to Safeway, because that involves crossing Raymond, which is not safe still, even though they did the red line improvements. So I feel like the food access, in terms of being a food desert, we definitely aren't that with the grocery stores that we have, but the proximity to us isn't what it seems, because they're not easily accessed safely.
Yeah, that's well said, actually. So that I would tell you that since Brian's not on the call, he had something come up. Brian Hannon, who's the head of the Shelby Street and Connectivity Action Team, we did a survey this past spring, summer, and into the fall a little bit, where hopefully you all had a chance to be a part of that survey, but it was an online survey, and then we had some hard copies that we took over to the library, and they helped us get some little bit more diversity in our responses with like renters and that sort of thing. But we learned of how people use Shelby Street, what are the areas where they see challenges or opportunities, and what types of businesses they would like to see at the different kind of nodes where the red line stations are. And the station that came to the top of the list as far as areas where we need to work on was that Raymond Street Shelby node. So in January, at our January Shelby Street Connectivity Action Team meeting, we are attempting to pull together a team from DPW, NDOT. I'm trying to think who else would be in on that. I think there was somebody else, but pull those people together so that we can actually have a discussion about what are the long-term plans, here's what we want, and how can we pull all of that together so that we have a vision to work with that's actually something we can work with. I think the problem has been that, up to a certain point, it's NDOT, and to another point, it's DPW, and getting those two entities on the same page and us being able to communicate effectively hasn't happened. So that's step one. That's where we're at. So there's that. Anybody else have anything about food access? That was a really good point.
Say something about Sen. I know that they're still giving out food every week, and I know it is like tripled, and they think it's still going to continue to be heavy demand. They've been running out of food too. So yeah, I think there's
about the
still.
Southeast Community Services?
I'm sorry?
Are you talking about Southeast Community Services?
Yeah.
Yeah.
Yeah. So there's obviously a huge need still in this community for food to give to people. And I'm really worried about Gleaners running out of money.
Ooh.
Hey, Michelle, it's Rob Campbell again.
Yeah.
One thing that, and I know we've talked a little bit about it in the Health and Wellness Committee, there is a wonderful resource from a website perspective that's called Aunt Bertha. And literally you go to www.auntbertha.com. And in essence, what it will do is it will give you the resources in your area by zip code. It goes from housing to food, medical, thousands of opportunities for people that need help to be able to seek it out from community benefit organizations. So I just wanted to make sure to mention that is available and a great resource.
Yeah, I appreciate you bringing that up. I haven't posted about that in a while, so I will definitely do that. Yeah, Cheryl?
I just wanted to say that we posted those websites on the tables at the library, and we got excellent feedback on that. So that is really an excellent resource. So I encourage everybody to tell others about that.
What I was going to ask about you were talking about Southeast Community Services, the heavy demand. Are they getting a heavy demand for deliveries, and are we able to do that? Or is that something maybe SoIndy could help with?
I know they have 3 people that normally do deliveries. I don't know if it's increased. Unfortunately, I haven't been back there for a couple of weeks due to other demands, but I assume that probably would be an excellent idea to talk to Carolyn and see if she needs more drivers.
And then are they accepting donations?
Probably not when they're small quantities, because they get those big pallets from Gleaners that they separate. Okay. So, yeah.
Okay, fair enough. Okay. So then the next question, Rob kind of started answering this, is what resources are there in SoIndy to meet these needs? So Aunt Bertha, and I would add that our website actually has a page on the website. I can put it in the chat, but we have a community resources page where there's different buttons that you can push within our website that lists like food pantries and there's different resources in our community. So that's something that you could share with people, but I would welcome you all to mention things that you know of as well.
There's also the Community Compass app. I think it's really nice. That shows all the different food pantries or where you can get free meals throughout the community.
The next question has to do with education. I will list these questions a little bit together. So the first one was, does SoIndy have e-learning centers? And another name for that would be like a community learning site. And then tied to that, is there help that can be had for struggling parents while they're doing e-learning? So, I mean, I consistently see, Facebook posts and things on Nextdoor about the struggles people are having with that. And I've been asked, is there ways that maybe some of our partners can help, like SoIndy, college students serving as mentors? So maybe you guys know of some things that are already happening, some ideas, and I'll list one website link that I know of in the chat. If anybody wants to tackle that first.
Well, we all know that the struggle for families is real. I have honestly come across the Fountain Square Learning Hub. I came across it on Facebook. I didn't know of its existence until then, and maybe that's a disconnect within myself that I need to be able to reach out more. Beyond that, I'm really not sure of other entities, and I'm very curious as to whether or not there are, because obviously we need to make these connections happen for families. I know within my own school, we have a group of people who are trying to connect families, with whatever they need. Beyond that, going to the University of Indianapolis, it makes so much sense that there's a plethora of people there that I'm sure would be willing to help any of our several of our families. So I think right now it's just making that connection and how we go about doing that and who needs what. So are there other learning hubs that I am unaware of?
Yeah, so this link that I just stuck in the chat, the communitylearningsites.org, when I clicked on it, I know the Keenan Stall Boys and Girls Club popped up, but I'm sure, each site might have their own unique attributes. So like they may only be open to their club members and like certain hours, like 3 to 6 is typically when they've been open for kids. So each program is going to be different. So it's going to take some research, but we might be able to help with that with our committee.
Michelle, I'm not aware of any community services that we're offering for e-learning. That doesn't mean they don't exist. That just means that I'm not aware of them. I can look into that and report back to the group and to the task force. I know bringing outside people to campus is a hard thing for us right now. Our current COVID restrictions are not allowing guests on campus for obvious reasons, but let me look into that and do some research and report back to you and the task force if there's availability for university to get involved in that space.
Great, thank you. Yeah, I think we're going to have to definitely think outside the box when it comes to that, because I was trying to connect some of our UIndy interns through the Health and Wellness Committee to some of the schools, and the problem was all of the volunteer programs at the schools were kind of shut down, and so they couldn't process the students. There was just nobody to really do that at this point, and so with protection of the kids, you have to have, you have to be able to do the fingerprint checks and all of that. So we're still working under the old system basically, but we have a whole new set of needs. So we need a new system of being able to volunteer at the schools. For your action team, or whatever action team that you're affiliated with, what might be a challenge or an opportunity for your team in 2021?
I think for the health and wellness team, this past year, we were able to do a lot of like collecting resources or making resources available. That was like part of our action plan, which was great. But we kind of weren't focusing on the action plans that are kind of more big picture that would benefit more if people could get together in person and talk. And so I think that will be probably our struggle for this upcoming year of, I guess, being able to do those action items with COVID restrictions in place.
Anybody else?
Well, maybe for our committee, I would think the first half of the year is going to be difficult.
Which committee are you referring to?
Community relations,
Community building.
community building. I'm close, right? It's one of those committees. I think we're going to be restricted the first half of the month, but I would assume or at least hope that by the, May or June, everyone would be vaccinated and we could do more of those community events that we used to do, where we would go to different businesses and promote them, or we would have a party in the park and the neighborhood would come. I just think, I'm hopeful that the latter half of next year, we can do more of those activities.
Exactly.
And Michelle?
Yes. Yes.
I think that everybody's going to have a really good opportunity to help. I think it'll be really weird for people to be together again. And I think it'll take some thinking about how to ease people into that and how to because I think that we were already our society was already moving apart from each other, no doubt, into more isolation. And so that's already been a problem. And then a lot of us have not been enjoying that kind of being in that position, but there are still people who aren't that social, aren't used to going out, are happy watching TV or being on their device at home. And so I think it'll be a group effort in our community to change that situation, even once everybody's able to get back together. I think it's not going to just be like you flip a switch and everybody's just hanging out and socializing and all their differences are, gone and everybody's, just getting along. I think, we've also been through a lot of other things besides COVID over the last year. And I think those things have also caused a lot of further division between people. And I think there's a lot to do with that. And I see that as an opportunity for organizations that work on helping connect people with each other in ways that really emphasize what we have in common a lot more than emphasize the differences that we have between each other.
I think this is Rob again, and I think one of the challenges that we have is that how do you decide whether you're going to take the vaccination or not? That's an interesting piece, and I think to Jim's point, I think that's a really, really interesting dynamic there is that how do people readjust in essence to getting back to quote unquote normal? So that's going to be a challenge, I think, for us from a healthcare perspective is that, making sure that all the information is out there for people to digest and figure out what's best for them and their families. And what I do hope is that I say this non-politically, that the media tries to make sure that it heals things versus divides. Just provide the appropriate information and allow people to make good decisions for themselves and their families. And whatever they choose to do, that's best for them. So that's kind of where we're at. It's an interesting dynamic for us as well. We're curious as to how many of our practitioners are going to take the vaccination. You know, that's one thing that we're educating our own practitioners, and I think that'll be an interesting dynamic to see. You know, and I think when you look at age distribution, that will be interesting for us as well.
Yeah, so as you roll that messaging out, you know, please include us. We'll, you know, definitely try to be a part of that.
You appreciate that, Michelle. We will.
I will share one thing that I think is a big opportunity for all of us in 2021. Garfield Park has been selected for the Earth Day Festival on June 5th. So June 5th, fingers crossed, an outdoor group activity will be permitted. And I just think that so many of our organizations and people will, you know, June is such a, you know, great time to get into the park. So help people come out and just feel good about our community. And so it's just a big opportunity for us all. I'm excited. And Rob, if Community Hospital South wants to in any way partner, I don't know if you are aware if you guys have already been approached from the event coordinator, but be happy to help connect you if you're interested.
Yeah, please forward it our way, and I'll get it to our community benefit group, and we'll see what we can do.
Noted. All right, well, I only have one question left, so if you have any questions that you wanted to ask in the chat, now is the time to do it. We'll probably be wrapped up in the next 5 minutes or so. Otherwise, just wanted to end us on positive notes. Not that this has been negative, but what SoIndy related accomplishment from 2020 are you most proud of? And I have a couple things listed here, but I'm going to save mine to the end in case one of you wanted to share it first. So anybody want to tackle that? And Ruth, you've been very quiet, so you have to talk. Yeah, Rob.
This is Rob, and I just want to brag on Christy Todd. I think Christy's done a wonderful job with health and wellness. Really appreciate her stepping up, and her leadership has been outstanding. So thank you, Christy.
Well, thank you. And I couldn't do it without the amazing health and wellness team. I will say that I've been so proud of what we've been able to accomplish this year, even with COVID. I know like our community gardens was able to donate almost 5,900 pounds of food to either volunteers or to local food pantries in the area. We were able to award 4 community garden mini grants as well into different areas in the SoIndy area. And we were also able to develop or update a whole bunch of resource guides, including like our food pantry resource list, healthcare, and fitness facilities and fitness programs as well.
Hi, this is Ruth Soper. I'm on the housing team, and so I haven't said anything, but we have had really quite a few successes. Even though they haven't been completed, we got things started. So one of the things the housing team has been working on for a couple of years is to work with SOCOA, the Center for Central Indiana Center on Aging, to have them come with volunteers to a SoIndy neighborhood. And so it took us 2 years to accomplish that. And so it happened in February 2020. And then we weren't able to really get all the volunteers together like we hoped and do as many homes as we hoped. But SOCOA did go ahead and help out. We focus on Bean Creek. So SOCOA put in some ramps, or facilitated having some ramps put in and rails and things that were outside work so that they could accomplish that. And then for a couple years, we've had the permanent supportive housing project going at Hannah and Keystone. And so we have property, and we're working on tax credits, and that will be a great thing to have for our city. Permanent supportive housing for people recovering from homelessness. And that, that's still in process. And then the other housing work that we've been doing is on Southern near Garfield Park, where the Church of God is. What's that address, Michelle? For something. It's at East Street and East Street and Southern. And so there are plans to create Garfield Parkside townhomes, which will have affordable housing included, plus family homes, which, since they're townhomes, they will help out families in the neighborhood, which helps out, which has been a need that was identified by Crystal House, 3 years ago as well. So we're making progress. It is slow. Do you have anything else, Michelle, about housing? I think it's good that we get shagged together again, South.
Yeah. So we're going to, at our next housing meeting, which is Monday, we're going to get an update from Big Car's APLR program. So that'll be great to hear, because they've been doing a lot, and with everything being shut down, we haven't been able to go over there and really see a lot of it and talk with the staff and learn what's going on. So it'll be nice to get some updates on what they're doing with the rentals, home ownership, and then pathways to home ownership, which is always an issue.
Yeah, I could talk about it for a second as a little preview. But one of the things that we're also excited about that has happened is 2 of the homes. One of the things that we've thought about as a community development strategy for housing is not only to supply affordable housing for people, but to also look at issues that are in the neighborhood that are causing people to have a lower quality of life. So when we think about acquiring houses to turn into affordable units. So 2 of the houses that we were able to buy on the block around the tube factory were basically being occupied by squatters who were not, who were just terrorizing their neighbors and really just creating a nightmare scenario for people who were trying to do good work in their community. And so we were able to eventually, these were where crime was happening, where people where gunshots were going off and all kinds of really bad things that affected a lot of neighbors. Those homes are now being renovated to be positive places for artists to live in that'll be long-term affordable housing. So it's more than just taking a vacant house, which was already a problem, but these houses were beyond the problem of vacancy. They were abandoned basically by their owners and were then being turned into something very negative. And so we're really happy. And as somebody who was following the saga of the houses from the perspective of the neighbors who were sharing about it on Facebook, basically every hour of every day, they were being terrorized by the situation. So it's very positive to see that turnaround. And now that we're closing on three more houses, right, or 2 more houses right now. We just bought one of those houses at the sheriff's sale through the city. So that puts us up to 15 houses on the block. And one of them is a double. So it'll be 16 units of affordable housing that are just on the block.
That's great. Does anybody else want to talk about an accomplishment?
This is Ruth. I just wanted to say thanks to Michelle 100 million times for putting together the video. It was so exciting to see all of it come together, and I was able to share it with, my friends around town, my family, because this has been my life for 5 years, so it helped them understand a lot. So thank you.
Well, if nothing else, 2020 has taught me a lot about social media. And so, yeah, it was fun to do. And I'm doing more of that. So I don't know if you guys have noticed the SoIndy on locations that I've been putting out. So those are fun, just little 1-minute videos on location in different places. So I've put out 3 now and gotten some really great responses. So thanks.
Yeah, I want to echo Ruth. Thank you, Michelle, for all the hard work that you've been doing serving as director for SoUth Indy Quality of Life.
Thanks. Thank you. All right, well, thanks for everyone coming on the call. I did record this, so I just need to redo the introduction. Thank you, Jim, for reminding me to hit the record button. So we'll be able to share out this video for anyone that wasn't able to join us. Took some notes so that I have some follow-up items that I can work on. And just look forward to working with you all next year. Thanks so much. Happy
Thanks,
holidays
everybody.
and Happy New Year.
Thanks, Michelle.
You bet. Take care.
Hi, everyone.